Hi, we have stopped sharing. You have the presentation, right? So, yeah, really better.
No, Vijay, I can't hear you properly. No.
हमने अपने साइड से presentation बंद कर दिया, so we have given those presenter rights to you, so you can share your screen if you want.
No, actually, I was trying to share the PPT from my end. So you can share the other one, the PPT which was there already. No, you just share it.
So we can start. It's 2:30. The YouTube link is live as well. So handing it back to Avnash and team.
Yeah, a very good afternoon to everyone, all the participants and eminent panelists. We have gathered today for this workshop, and that this workshop is on designing evaluation for food safety net. And this is a skill building workshop, and so this will be a bit lengthier, and it will be for about 3 hours. So I will go through the steps which we will follow. And so we have here as our panelist Dr. Abhay Kumar. He is head of evidence results unit and of WFP, and Dr. Shivendra Srivastava, scientist, agricultural economist from ICAR. And I will be giving a brief description about our panelists. So can we begin with the housekeeping rules, Vijay? We can go to the next slide. So for posting Q&A, so in this session we have these options for on the laptop. You can do it on the Q&A throughout the session. You can post, and in your mobile also you can post your comments, your questions on the chat. So we will be taking up all these questions during the audience time, which is there for audience interaction. So can we go to the next slide, please? Yeah. So this is the layout which provides you a clear view of the entire this thing. So you can click these buttons to have change your focus and try navigating the presentation. So, list of speakers. So the panelists we have, I will introduce each of the panelists one by one. So we are here joined by Sri Dr. Shivendra Kumar Srivastava. He is a scientist at National Institute of Agricultural Economics and Policy Research, New Delhi. He belongs to the 2007 batch of Agricultural Research Service and joined ICAR in 2010. He also holds a faculty membership in PG faculty in the discipline of Agricultural Economics, Indian Agricultural Research Institute, New Delhi. His research interest includes sustainable agricultural production and food demand analysis. He has authored and co-authored many research papers on sustainable agriculture, groundwater use, irrigation, livelihood, labor markets, household food demand, consumption, and food baskets, etc. A very warm welcome to Dr. Shivendra Srivastava. We are also joined with Dr. Abhay Kumar. Dr. Abhay Kumar currently serves as the head of Evidence and Research Unit at the United Nations World Food Programme in India. In his current capacity, he works in close partnership with national and state governments to strengthen their capacities in monitoring and evaluations. Dr. Kumar specializes in population and development issues. His areas of particular interest are food and nutritional security, poverty, and human development. He has completed a number of research and evaluation projects with significant policy implications, supported by WFP, UNDP, Sir Dorabji Tata Trust, National Commission on Minorities, Ministry of Rural Development, and several others. And myself, I am Abhinash Das. I am Joint Director at DMEO. I'm looking after evaluations of various schemes, including NFSA and food and nutritional security aspects. So I welcome you all the panelists. A very warm welcome to all of you, and also to the participants who have joined us for this workshop program. So now, basically, there are two parts to this session. We will have a 2-hour part A session in which we will be actually going through the entire the designing and the evaluation process, the theory of change behind the food and nutritional security and safety nets in India, the exist its current situation, and compared to the global how we are faring, especially in the back of the NFHS data 5 coming out the unit level, we are surely not doing that much well in terms of nutrition, anemia. So, how exactly we can see the theoretical underpinnings behind such food and nutritional safety nets, their importance in our current economic and socio-economic scenario, and also will try to measure them through various kind of indicators that provide us something which we can measure. So unless it is measured, we can't have any improve. We cannot say whether it has improved, deteriorated, remains the same. So we need measurable indicators which are representative of the food and nutritional security in our country. So, and also learning from global best practices. And finally, we also will discuss briefly about the evaluations designs that has been followed in India in evaluating this food and security safety net, food security and nutritional safety net. And so this will be actually the kind of one-way session, the part A, where it will be mostly three of us will be giving a capsule on which I think most of you would be already knowing, but kind of refreshing and getting into the groove of it. So we will be this part A will be a 2-hour session where mostly we will be speaking for about 1.5 hours. Then there will be audience interactions and moderated discussions also. So this is this part A is like all of you can attend. Part B is actually learning by doing. So this is we will whatever we learned in part A, we'll be trying to use it and have a small exercise group activity in order to learn from do whatever we learned in the 2 hours. We'll try to apply it, and this is optional. So if you want to do it, then it's fine. Otherwise, after 2 hours at 4:30 you can log off that. So this part B is optional. So we can move to the next slide. So now I would invite Dr. Abhay Kumar. So to share his views on the theoretical underpinnings and the theory of change with regard to the food and nutritional safety nets in India, the global best practices which we have, and learnings for us going forward. And especially India is at a crossroads where we spend so much on the food and nutritional security aspects, but the progress has been tardy. So over to you, Dr. Abhay Kumar.
Thank you, Abhinash, and thank you, Team DMO, for this opportunity. I welcome all the participants in this group, and I hope this is going to be a good learning session for all the participants. As Abhinash has already elaborated, the purpose of this skill building workshop is basically to understand the food security nutrition. What is it? How is it measured? How it is evaluated? And how do we generate evidences around food security and nutrition using several indicators and indices that we have with us. So I will begin with providing an overview of food security and nutrition. What is it? And what are the food safety nets? What are the food safety net programs in India? I'll also briefly touch upon some of the work that WFP is doing globally. My organization is doing globally. So I'll try to take you to a kind of conceptual understanding of the food security and nutrition, and I'll also try to give you a kind of historical development of this concept of the food security and nutrition. So to begin with, let me share my small PPT that I have put. Let me put it on the screen. And please confirm if you can see my screen. Is my screen visible to you?
Yes, it's visible.
Yes, it is visible.
All right, thank you. So basically, these are the three things that I'm going to discuss initially in the first part, in the opening remarks. So I'll be basically trying to deliberate upon the conceptual development of the food and nutrition security. Then I'll be discussing what the different kinds of food safety net programs that exist in this world, and then we will be discussing about India's food safety net program. So this is what I'll try to elaborate in the next 15-20 minutes time. So to begin with, you see, the concept of food security and nutrition is not a very old concept. It was basically coined during 1970s when we had a very difficult famine kind of drought kind of situation globally, and there was an overall scarcity of food grains in the world. So at that point of time, this terminology food security was coined. But when this term was coined at that point of time, the major focus of this concept was on the food availability, because there was overall paucity of the food globally. So the entire efforts was on how to increase the production, how to increase the supply of the food grains. But later on, in 1983, this concept, this idea, this definition was challenged by none other than the Indian Nobel laureate of economics, Professor Amartya Sen, wherein he brought in the concept of the entitlements, and he said that merely availability of the food is not food security. So he brought in a concept of new entitlement, and he added a new dimension called food accessibility. Later on, again, World Bank and other agencies, they were working globally, and they found that, of course, food availability and food access is a wonderful concept, but there is another component which is equally important, and that is known as food utilization or food absorption. So basically, what do we mean by food utilization and food absorption? By food utilization or absorption, basically the idea was to provide a kind of very healthy and enabling environment so that whatever food we consume, our body utilizes it, our body absorbs it. So why do we take food? We take food for getting energy and nutrition out of it. So there were instances globally where the food is available, where the food is accessible. Despite that, the food security was not there. The nutritional outcome was poor because the food utilization and absorption related factors were not there. So just to cite an example, the safe drinking water, it was a basic component which was not food, but it was one of the very important factor which was basically contributing to the food security. So that is how similarly the availability of sanitation facilities, availability of public health centers. So likewise, there were a number of indicators that were enabling indicators which was leading to the food absorption or utilization. So, slowly and steadily, the way the concepts evolved, the concept, no concepts are static, it keeps on evolving. Similarly, the concept of food security keeps on evolving. So by 1996, the United Nations, in one of its World Food Summit, it tried to give a very comprehensive definition of what is meant by food and nutrition security. And if you read this definition, which I have tried to put it on the screen, it basically captures all these dimensions that I have just talked about. It talks about the food availability, it talks about the food accessibility, it talks about the food utilization. Besides, it also talks about the food preferences, dietary needs, and so on and so forth. So this definition is basically considered as the currently it is considered as one of the most acceptable definition, because it is being approved by all the nations in the UN World Food Summit in 1996. So that's one part of the definition. But if you come to India and look at the Indian acceptance of what we mean by the food security and nutrition, we refer to our National Food Security Act 2013, wherein in the objective of the act it has been very well illustrated that the food security, basically the National Food Security Act is trying to provide the food and nutritional security in human life cycle approach by ensuring access to adequate quantity and quality food at affordable prices to people to live a life with dignity and for matters connected therewith or incidental thereto. So this is the not definition but the objective of the National Food Security Act, which is enshrined into its gadget, and basically it tells about what, when we talk about the food security in India, what do we try to cover inside this particular definition. When we discuss about the food security and nutrition concept, in 2019, UNICEF brought out another conceptual framework to understand the food security and nutrition, and it has tried to give a different pathways. So when we talk about the food security nutrition, as I have stated earlier, it has availability component, it has access component, it has utilization component. So all these components play at different levels. So there are three different levels if you can look at this conceptual framework, which is first is community level, the second is household level, and third is individual level. So at community level, basically what we do is that we have the availability related factors which play very well. On the household level, we have the access related issues. So whenever we work around the access, we try to work at the household level. On the individual level, we have the challenges of utilization. So we work around the food utilization and food, absorption. So these are the three different levels by which the food security and nutrition has now been conceptualized. And there are interplay of various other factors, which is related to other enabling factors on production, exchanges, cash, and so on and so forth. So basically, these, other than these three factors, the three dimensions that I'm talking about, there is another factor that has now recently been added, not recently, but yeah, it is now considered as a vital component and vital dimension of the food security and nutrition, and that is known as food stability. So food stability, when we talk about, other than it plays both in all the three other dimensions: food availability, food accessibility, and food utilization. So when we talk about the food stability, so right now we have lots of challenges around the climate change and related factors. So from that perspective, food stability or its sustainability is very, very important factor. So that is now also considered as the fourth pillar of the food security and nutrition. So there are largely now, as we have discussed, there are four different pillars. One is food availability, food accessibility, absorption, stability, and all that four dimensions contribute to the food security and nutrition. So here I have just cited some of the indicators from a study that we conducted long back in 2009-10 on measuring the food security and nutrition in the country, into the rural parts of the country, into 8 states. So here we had identified some of the indicators around each of these dimensions, and then we tried to look at how the combination of these indicators bring out the food security and nutrition in the country. So these are the four dimensions. Using these four dimensions and the indicators that I have just cited, we had also tried to calculate the food security index, and we have tried to display it on the map also. These are the 8 states on which we have worked, and we have tried to show how the food security index or indices are working into the different districts of India. So this is a district level analysis, but if you see this map, you will definitely see that the food security or food insecurity in the country is basically spread in a region, not in a particular district or not in a particular state. So if you see here, the food, there is a continuous belt of food insecurity right in the center, the dark brown color. And that's a belt that extends from Bihar to Jharkhand to Chhattisgarh to Madhya Pradesh, and also to some extent to Orissa. So therefore, these are some of the way by which we try to understand, we try to measure the food security and nutrition, and try to project it and try to identify the issues. Now then, we also try to understand what are the factors that is basically you know uh, uh, leading to the food insecurity in this particular region. So these are largely the food and these are largely the tribal dominated region. They are also the forested and hilly tracts region, the tribal plateau regions, the Chota Nagpur plateau and all. So these are some of the components which is basically inhibiting the food security among the vulnerable population. So we had, also suggested number of policy measures around working in this particular group. So this is, I just try to illustrate on how these dimensions basically try to play together, and then how do we try to measure the food security and nutrition. Now, coming to the food safety net programs. So, the each country tries to have some or the other food safety net programs. The food safety net programs have different purposes. One of the key purpose of any food safety net program in any country is to basically relieve deprivation and improve nutritional status, perhaps through the direct provision of food. So each country has a responsibility towards its citizens to protect their life, and food is directly related to the life. So if we are not providing food to the population, we are taking the lives of the people. So each government is very, very concerned about ensuring this particular right to the people. So food safety net program is one such program which is basically trying to relieve the deprivation and improve the nutritional status. Secondly, the food safety net programs also helps in increasing the purchasing power of the people. So in many cases, it's not that the food that is being, it's not the kind transfer, it's also the cash transfer. So many government also tries to provide cash to the people, and they basically, that increases their purchasing power, or food stamps or food vouchers. There are a number of other, food safety net ways by which they try to ensure the food security of the people. Thirdly, there are also programs globally which basically ensures livelihood. So you might have heard, even India was having a program earlier called Food for Work. So likewise, there are several public works program globally which basically tries to provide food instead of the work that they do for the country. So there are different purposes, there are different ways because by which the food safety net programs are ensured. And as a result, you will see that There are kind transfer, as I said, that we distribute the food. There are cash transfer, there are conditional cash transfer, there are food for work, there are food stamp, food vouchers, and then there are supplementary feeding programs. So there are different forms of food safety net programs that exist in the globally. Now, WFP, since is a UN organization, UN Food Organization. Of course, there are two other organizations which also are considered as the UN Food Organization. Together with World Food Program, there is a Food and Agriculture Organization, and there is an International Fund for Agriculture Development, IFAD. So these three programs are called Rome-based agencies because they are headquartered at Rome. But they are mandated to ensure the food security of the people globally. So World Food Program is basically, as you might be knowing, that it's a humanitarian organization serving food to more than 85 countries in the world, reaching out to 125 million people globally every day. So it is a huge supply chain network, and wherever there is a conflict, wherever there is a disaster, wherever there is a need of food, WFP is the agency which reaches with the food instantly, and they try to serve the food to the people. So basically, WFP also has two dual role. One is about the saving lives, and the second is about the changing lives. So when we say saving lives, basically we try to give the direct kind transfer to the people. But when we say the changing lives, we also try to use the food safety net programs of the World Food Program in order to improve the livelihood of the people. So this is how the World Food Program is operating. There are different global factors which is basically uh, impacting the hunger globally. And one of the biggest factor impacting the global hunger is conflict. So 65% of the global hunger is being contributed by the conflict. So therefore, when we received the Nobel Prize in 2020, there was a clear-cut message that food is used as a weapon in the war. And in some of the Russia and Ukraine crisis, we are seeing that food is now being stopped at the Black Sea ports, and as a result, what is happening is that there is a global scarcity of the food grains, wherein the food availability has now become a challenge. So conflict is used as one of the contributor or one of the factor which is basically inducing the hunger in the globe. Second biggest factor affecting the food security and nutrition is the climate change. Very recently, you all are based in India, and you have seen that the recent rabi production has gone down. It was not as per the estimates, and Shivendra ji will try to explain it further, because one of the reasons that is being cited that we had a very high heat or very high temperature in the month of March, which has basically reduced the wheat productivity, wheat yield, and as a result, we had a very low rabi productivity. Now, this particular heat wave in the month of March was also considered as highest, March temperature in the 122 years. Likewise, there are several other climate-induced factors such as cyclone, droughts, and other disasters which is impacting the food security across the globe. If you want to see the impact of the climate change, look at the case of the Africa. There are a number of North African, Western African countries, even in the Eastern African countries of the Madagascar and all. You go and see the changes that it has. The entire region is fallen into the drought situation. So these are some of the factors basically which is which is basically impacting the food security and nutrition globally. Then is the economic slowdown. So wherever there is an economic slowdown, wherever there is a price rise in the food, it impacts the vulnerable population very much. So as you might be knowing that the poor population spends their highest proportion of their income on food. So the moment a little bit of price rise is there in the vulnerable population income, it is going to impact their food security and nutrition, and they start doing the coping mechanism. So from that perspective, we see the price rise as one of the biggest contributor to the hunger in the world. So therefore, global price rise as well as Indian price rise, it is always considered a very serious issue, and we try to tame them before it goes into a crisis situation. So now you have seen into the Russia-Ukraine crisis. This Russian-Ukraine crisis has now added to the global food insecurity. The global food price is rising, and all this has happened just succeeding the COVID, where we already had a very tough situation. And even prior to COVID also, the situation was getting tougher. But then we had COVID, and now we have the Russia-Ukraine crisis. So the global food crisis is still there, and it is impacting the food security and nutrition globally. But I'll now again turn back to India. Now in India, as you've seen, as Avinash has also detailed out, that government of India is spending a huge money on the food safety net programs. But despite investing so much of money, the outcomes, the food and nutritional outcomes that we receive from different survey data. For instance, very recently we had the NFHS 5 data, and we have seen that all the outcome indicators are performing very badly. And as a matter of, it's a big matter of concern, and we need to try focus on that. So I have just cited some of the statistics here on the screen. The first is about the India's contribution to the global hunger. So this statistics comes from the SOFI report, State of Food Insecurity in the World report, that is a flagship publication of 5 UN agencies together with the World Bank, and it comes every year, and it tries to project the food security and nutrition situation globally, and it also tries to estimate the global hunger. So it has shown that 30% of the global burden of hunger is being contributed by India. And that's a huge population. Can you imagine the 30% of the global hunger or the food insecure people are in India? This is despite of the fact that we are spending billions and billions of dollars on the food safety net programs. Not only that, look at the Indian statistics. More than 1/3 of the children less than 5 years are stunted. 1/4 of the adolescent girls, which is between 10 to 14 years, have low body mass index. More than half of the women aged 15 to 59 years and 15 to 19 years are anemic. And same is the situation with the children below 5 years. So the nutritional outcome is very, very poor. And as a result, the food security and nutrition programs in India is a very, very important program. And government gives due importance to it. And as a result, you will be surprised to know that government invests one of its largest subsidies on the food safety net programs in India. And this has now further been added because during the COVID, as you might be knowing, that due to the Pradhan Mantri Garib Kalyan Ann Yojana, we have topped up the provisions of the food security by adding the equal amount of the food grains free of cost to the people. So that has further been now added to the that is further added to the fiscal cost of of India. So now turning back to India's food safety net programs, as you know, India has legislated a very comprehensive program in 2013. And the name of that particular act is called National Food Security Act 2013. It is considered as one of the world's most comprehensive food safety net programs globally, because it reaches out to 1 billion population every month with dry ration or hot cooked meal or supplementary meal every month. 1 billion population, can you imagine this? The World Food Program, through its global operations, only reaches to 125 million population. But India alone reaches this vulnerable population to nearly 1 billion population. So out of 1.4 billion population, 1 billion population is already covered by one or the other food safety net programs. There are 3 different and big programs which you all are aware of. That one is TPDS, the second is PM Poshan, which was earlier known as midday meal, and the third is Integrated Child Development Services Scheme, which is ICDS. Now, TPDS alone reaches out to somewhere around 800 million population every month. 100 million children studying in the school are being reached by PM Poshan with a hot cooked meal, and ICDS tries to provide the hot cooked meal as well as supplementary nutrition in the form of take home ration to nearly 80 million children and pregnant and lactating women. So this is how the comprehensive the Indian National Food Security Act is. Now there is also if you look at the definition of the food security there, it provides the food security into a life cycle approach. So when we talk about the life cycle approach, it, that means whenever a mother is, you know, a baby is conceived in his mother's womb, since that day till the baby gives birth to till he grows old, and this National Food Security Act is committed itself to provide the food security throughout the life cycle approach. So during the pregnancy as well as during the first 6 years of the age, the ICDS takes care. From 6 to 14 years, the midday meal takes care, and from 14 to till the till the death, the food the TPDS takes care. So this is a very comprehensive, globally comprehensive food safety net programs. Now, what are the key provisions of the food safety net programs? If you see the TPDS, the targeted public distribution system, which basically reaches out to 800 million population of the world, basically is providing 5 kilograms of food grains per person per month at a very highly subsidized rate of rupees 3 for rice, rupees 2 for wheat, and rupee 1 for coarse grains. There is another program which is still existing together with the NFS, together with the the TPDS, is called Antyodaya Anna Yojana, which is basically meant for poorest of the poor, and has a provision of 35 kilograms of food grains per household per month. So the typical NFSA provisions for the priority households is 5 kilograms per person per month. But for Antyodaya Anna Yojana, it is 35 kilograms per household. So there is a difference between the entitlement between the individual as well as the household. Now, this 5 kilograms of food grains per person per month reaches to somewhere around 67% of the population of India. That means in the rural areas, it covers somewhere around 75% of the population, and in the urban areas, it covers 50% of the population. Pregnant and lactating women, as I said earlier, it is now covered under the ICDS program, and they receive the meal free of charge during pregnancy and up to 6 months after the childbirth through the local Anganwadi centers. Apart from that, there is also a scheme called maternity benefit of not less than rupees 6,000. Basically, this particular provision has now later been converted into Pradhan Mantri Matritva Vandana Yojana, and under this, the pregnant women are supported with 6,000 rupees to ensure their food security and nutrition during their pregnancy time. So it's a very comprehensive and very unique right-based legislation. As I said, it's a right to food-based legislation. That means it ensures that come what may, it is the responsibility of the government of India to provide food to the people of India. There is also a provision within the NFSA wherein it says that if the government of India is not able to provide the food to the people, it will provide food security allowance, which means it will provide some kind of allowance to the people so that they can go to the market and they can buy food. So this is what I've tried to give you a kind of snapshot of, the basic conceptual understanding and also the food safety net programs that exist and how it is, trying to cater. We also tried to look at some of the key factors affecting the food security and nutrition globally. So I'll stop here, and maybe I'll hand over the floor to Abhinash for taking it further.
Yeah, thank you, Dr. Away, for a quite comprehensive like timeline through. You have laid out the beginning of the concept and how it has changed over the years from 1990s to the present Ukraine crisis. And you have brought out some concepts of food stability and right to food and what we are doing. And you have also went into the nitty-gritties of what are the provisions under the current food and nutritional safety net program under NFSA. So actually, that actually sets the stage for further discussion and gives a very comprehensive background of what the food and nutritional safety net is all about in India and globally also. And one very interesting point, for me actually, as using food as a weapon. So we'll come to that. In the discussion later on. So I now hand over to Dr. Shivendra Srivastava for his presentation on overview of food security and nutritional indicators and the measurement, the tools which we use to measuring such kind of security net programs. Over to you, Dr. Shivendra.
Thank you. Thank you very much, Dr. Das, DNU World Food Program. Thank you very much for giving me this opportunity. I hope this my screen is visible. PPT is visible.
Yeah, yeah, it's visible. If you can put it in full screen mode.
Okay,
Yeah, it's fine now.
correct. So thank you so much, and I am particularly thankful to Dr. Abhay Kumar for providing a very crisp and sound theoretical underpinnings on the concept of food and nutritional security, and which has really made my job a bit easy, because some of the things which I wish to share actually he has covered. So thank you so much, Dr. Abhay, for providing a very sound and very plausible theoretical underpinnings about the food and nutritional security and it's the system which is being prevailed in our country. I have been asked to provide briefly discuss about some of the tools, some of the indicators that how we can measure the food and nutritional security. So actually, I earlier planned that for the theoretical plausibility, I should also throw some lights on that how the concept of the food security, nutritional security, and now it is being taken together has been evolved over a period of time. And this has actually been very aptly covered by Dr. Abhay Kumar. And he has, in fact, told that earlier that how the concept has evolved from only the supply side, that when the 1942, that after the World War II, that the concept of food security originated, and it was only confined to the supply side using the Malthusian approach that we should have at least higher growth rate in production as compared to the population so that we can provide enough food to everyone. But later on that thanks to the work by the Amrit Pichayan and others, that demand side factors and the dimensions were added to the food security. And now the widely accepted definition of the food security is given by the World Food Summit, and which was also modified by the 2009 declaration of the World Summit on Food Security, and it includes that it exists when all the people at all the times have the physical, social, and economic access to sufficient, safe, and nutritious food to meet their dietary needs and food preferences for an active and healthy life. This the concept of nutrition till then was actually an integral part of the food security, but later on it has come that nutritional security has come to the center stage of the planning and development, and with the addition of the components like some additional factors are important if we really need to see the improvement in nutrition, and those factors in addition to the food security are the access to the infrastructure for some of the factors like the sanitary environment, adequate health, education, and care. So if we can add the concept of food security and plus add the dimensions of the access to some other non-food factors, particularly related to health, education, sanitation, and all those type of things. So it actually completes the nutritional security. And now the concept is being taken as together. It's being promoted as together. Some people say it as a food and nutritional security. Some people say it as food security and nutrition, but the overall components are the same. We have the 3 to 4 components in that, which are known as the dimensions of the food and nutritional security or food security and nutrition, whatever we would like to spell it out. And it has been elaborated very heavily by Dr. Abhay that it includes the aspects of the availability, it includes the accessibility, utilization, which is nothing but the absorption of the foods and derivation of the nutrients out of the foods when within the body of the households. And then the stability, which is nothing but the component of all the three concepts, that how stable all the three dimensions are there. So based on these things, these dimensions, I can, if my job is to give some of the indicators, so we should try to work in a system approach and try to cover each and every dimensions of the food and nutritional security and see that if we can derive some of the indicators on that. So it's a sort of the system approach where if we take the nutritional outcomes and uh, we estimate outcomes in any of the variables like anthropometric variables or any other nutrient intake related indicators, but the pathways and the system will be a sort of same. And it's a sort of the multi-dimensional system which is affected by the multiple factors which makes this phenomena a very complicated and a complex. So we need to understand first that how it actually works before we try to measure it. That so I will be trying to little bit elaborate what are the factors at the different levels and different dimensions affect the nutritional outcomes. And first of all, it's nothing but I think most of people must be aware that it's the production aspect, which is an essential component of the food and nutritional security, which ensures that we should have at least a minimum amount of the food in the required quantity, not only the quantity but also in terms of quality also. If we need to ensure the food and nutritional security. But this as a concept has been evolved and now we have the theoretical underpinnings as well that mere availability is not sufficient. It has to be accessible. It has to be consumed by the households also. So at the household specific, once the consumption is taken into account that it is influenced and affected by so many drivers at the household specific factors such as the actual consumption of the food, even though if it is available, but it may not be consumed by the household or the individual, it will be affected by the multitudes of the factors such as income of the households, not merely the income, how the income is spent between the food and the not food means the expenditure pattern. Within the food, where the income food expenditure is distributed, whether it is more biased towards the cereal pulses or the milk and other more diversified towards the different components so that we will have a better that status of the nutrients intake. Then awareness about the food and nutritional issues. This if we see the this NSS data and consumption expenditure, and we found that in terms of calorie intake, even the top 10% of the households in terms of expenditure or the income, they are also about 20 to 25% are undernourished. So it's not only the income, it's not only the affordability, it's also about the awareness and their understanding about the nutrition. That is also important and that needs to be captured. And then the family composition. There are other factors which are very important, which influences the overall outcomes in terms of nutrition and food security is the affordability component, which is affected by the food prices, non-food prices, and the likewise that it is really important that we should be able to provide a stability in the prices which is being paid by the consumers. The institutions, as likely being pointed out by the Dr. Abhay Kumar, that we have the world's biggest institutions and the governance program for ensuring the food and nutritional security in the nation. So these institutions play a very, very critical role in improving the nutritional security and not only the nutritional security program, there are many other programs as well which indirectly actually influences the nutritional outcomes, such as the poverty reducing programs such as Narega, other such developmental programs. So these are very, very important components. And finally, then once the person is able to consume a particular amount and the composition of food, then also we cannot be ensured whether it will be given a desirable outcome or not, because it will be affected by the how the food is actually being absorbed by the body, how the body is absorbing the nutrients, and that depends on whether the body is free from diseases and infections, whether the household is having access to sanitation, sewage, and those type of that water supply and other sort of things. So that infrastructure is very, very critical in improving the nutritional outcome. So if we are trying to go for evaluation studies, if we are trying to really measure the food and nutritional study outcomes, we really need to consider multitude nature of this whole system before we try and seek the indicators and the tools available with us. So this is important to us. As far as utilization is concerned, I would like to share one uh, uh, linkage that suppose there is a presence of disease or infections to the children. So in case of those infections or the frequent occurrence of the infection, their immunity of the children will be reduced. And once the immunity of the children is reduced, it will adversely affect the absorption, and due to the lack of absorption, again it will be child will be prone to the disease and infection. So it will be caught in the vicious circle of the this undernourishment or undernutrition. So that requires that we need to be very careful for planning these type of programs. And one tool which is available with us is that theoretically we have shown that it has to be integrated, and now we need to see that how we can actually integrate the different components and different skills so that we can actually lead to the improvement in the nutritional outcomes. Now coming to our main agenda of the workshop is that how we can measure the food security and nutrition. So we probably have three broader approach. There are so many techniques, so many tools available with us, but we can group broadly into the 2 to 3 broader categories. One is that we can, and it's all depends on what are our objectives, at what level we are going to assess it, whether we are going to assess it at the household level, or we are going to assess it at the meso level or the macro level, or the or those type of things. So so it all depends on that. Choice of the tools, choice of the indicators depends upon our objectives, that what actually we are going to assess, whether we are going to assess the food and security status as a whole, or we are going to evaluate the effectiveness or the impact of a particular program. For example, the food safety net program as told by this Dr. Abhay Kumar. Then we have first of all index approach, where this is the most widely applicable approach, and where we try to identify some indicators and then combine those indicators, develop a sort of composite index. Some of the well-known indicators at the global level are something like the global hunger index, global food and security index, and poverty and hunger index, and those all are available. And we do see the relative conditions or the positions of the countries. I will come again on this that what are the indicators which we can take in the index approach. Then suppose and this index approach is a sort of indirect approach. So we are trying to take it as a proxy for assessing the food and nutrition security indirectly through the indicators. Sometimes people ask a question that why not to go directly to the households to, or the beneficiary of a particular program, and directly ask her that whether he or she is the nutritionally and food secure or not. So based on that, we also have in literature some of the measurement tools like experience-based measurements like food insecurity experience scale technique, in which we actually measure our response of the different beneficiaries, and then we this convert those response into scales and scores, and based on that we can know the relative position of different households or even the countries in terms of this scaling. So we have both the pros and cons about these two approaches, and depending upon our requirement, depending upon those pros and cons and resource availability, we can use these methods. Finally, we have the statistical and econometric modeling. Of course, this in our crew also we do use the we do integrate the use of statistics and econometric, but we can also plan a sort of sophisticated modeling using the if we have the enough availability of data and the objectives clear in our mind. So I will one by one, I will just go through and briefly uh, tell that what are these approaches where we can use, how are the indicators which we can use. So I actually will be following that. Suppose if we need to apply an index approach for assessing the food and nutritional security, the most widely accepted framework is, as also told by Dr. Anna, is that we can divide our dimensions into four parts. One is availability, accessibility, then utilization, and then stability. Then within each dimensions, we need to identify the indicator which will be perfectly reflecting that dimensions. So there is the main challenge, that how we identify the indicator which best reflect the that particular component. And also it should be simple, it should not be very complicated indicator, it should be, data should be readily available for that indicator. And those are some of the criteria that while deciding the indicators in that. Let us first move to the concept of availability. That availability, this it relates that whether a household or whether a particular geographical area is having enough availability of the food of a given quality as well as quantity, so that it can meet the requirement for the minimum basic requirement for the healthy life. So one of the most basic uh, indicator is that food availability, that we can uh, estimate the, suppose if our objective is to assess the or the rank the different districts or the different states in the country, then we can use very well use this in these indicator approach, because most of the administrative data is available either at the district or the state level. So for those purpose, for those situations, we can very well use these things. So for the food availability, we can take the indicators something like the per capita availability of different food groups like cereals, pulses, nutricereals, milk, non-veg, etc. We can take it individually, or we can sort of aggregate these into a overall per capita availability of food. Then aggregation will be a problem. Then we convert in terms of calories or the proteins, or in terms of some other price equated aggregated terms, or whatever aggregation principle or a criteria we found is suitable based on the data availability. So based on that, we can depict the situation of a particular geographical area in terms of the food availability. Sometimes it happens that its particular food basket is dominated by cereals or something. Like India is a typical example for that. We have the poor diversity in that. But the this, from nutritional point of view, it's not only the calorie and protein which is important, but the micronutrients and other sort of vitamins and other those things are also very, very important. So we can take a production diversity as a proxy for the micronutrients and other sort of things. So availability aspects make our, if we take a diversity index prepared based on either proportion of area or production of different food groups in the total food production, and that may reflect the sort of that availability of different micronutrients, vitamins, and those type of things also. So production diversity related component may be a supplementary indicator to the food availability. And then the third, we can have a sort of resource assessment of some of the resource availability. Do we have access to enough resources for production of that enough and the sufficient quantity of the food or no? So for that, we can have some basic indicators, something like the what is the percent of total area available for cultivation, what is the percent of total cultivators out of total workforce. It means that what is the resource availability for land, what is the availability for human resources for the production of enough food. So those can be taken as a proxy to represent the dimension of availability, dimension of the food and nutritional security. Second dimension is the dimension of accessibility, which necessitates, which spells something like this. It is not it is not sufficient to have only availability. It should be consumed also. I mean, food should be consumed also. So for that we can have a sort of the, in terms of nutrients intake, how much of the total nutrients which is derived from different foods is intake, what is the net intake of those different nutrients. So one of the gold standard indicator in terms of the nutrient intake is the incidence of undernourishment or the malnutrition. So, and for that we have some challenges, but I will come to later on. Then incidence of undernourishment can be supplemented, like in terms of availability, it can be supplemented with a dietary diversity index, in which we can calculate a sort of diversity in the nutrients intake by the different households. So this parameter is more important at a household level, if we can apply to for assessing the food and nutritional security at the household level. Then access to safety nets. That as I said this in the my earlier slide, that we need to see that how the institutions are contributing to the nutritional security. So we need to see that how the access to safety nets, like midday meal, ICDS, PPDS, and all those things are having some impact on that. So for that, at the macro level, we can have some indicators, and some of the indicators may be something like that, like number of PDS outlets or the fair price of per thousand of the population, maybe bifurcated by rural and urban regions, because the situation is different by the rural and urban. Then the proportion of population having access to PDS, ICDS, midday meal, and etc. So we do have provisions in our act that 67% of the population will be covered by the NFSA. But whether it is actually being covered by NFSA or not, and that has to be seen by estimating the proportion of population having access to PDS and other things. Third, it may be further supplemented that for the actually food and nutritional outcomes, once our objective is to see the outcome, we should actually see that uh, access to PDS can be supplemented with what is the uh, proportion of total calories intake which is supplied by the PDS, or proportion of total food, rice and wheat and other whatever is being supplied, but how much proportion comes from the PDS supply. And those things can make a picture complete or the system complete. That not only access is important, but also that utilization of that food or the supplies from PDS, whether it is actually being consumed by the beneficiaries or not. So those becomes important indicators once we try to assess the dimensions of the safety nets and accessibility. Infrastructure. Infrastructure is very important. That accessibility, that whether the most of the farmers or most of the residents are having access to markets or not. That nowadays that production centers are different from the consumer centers. So that markets play a very important role. So whether the consumers are having access to readily access to market for purchasing the required food produce or not. So one of the indicators at the macro level we can take it as the percent villages where the weekly hearts are held or not in at the district level if we want. At the state level we can have the same thing at the district level. Then access to safe drinking water, whether the access to sanitary condition, and these conditions are very important if we really want to measure the outcomes of in terms of nutrition, because it's not only the food. As definition also says that food security has to be complemented with the infrastructure such as access to clean drinking water, sanitation, health facilities, and those type of things. So these type of infrastructure related indicators must be complemented if you want to evaluate the outcomes in terms of the nutrients, nutritional outcomes. Some other indicators can also be taken, number of banking institutions to see that whether financial resources are accessible or not. Then further, taking a proxy for awareness, we can have an indicator related to education, like literacy rate or the percent of population with more than metric level education. Although this may not depict perfectly, because even the educated persons may also not be aware. So some of the other indicators can be through that mass media, social movement, and those type of things can be complemented if the data is available. Then the affordability is very important for having access to the or actual consumption, and in that context, the income is the foremost thing that, and most of the studies or almost all the studies in the literature has shown a positive association between the income and this food intake and then the nutrition outcomes. So it is very important. But in my own study, I found that mere income, having income is not enough. We should also supplement it with that out of total income, how much of the total income is actually being spent on food. That also is very, very important. So for the food, because if the most of the savings, where the income is going mostly for the savings or mostly for the education and some other non-food expenses, then probably it may not be enough for the consumption of food and other things. So that share or the expenditure pattern which we say is very important, and that has to be captured through some appropriate indicator. Lastly, the utilization is actually utilization can be very well captured by the anthropometric outcome indicators, and most of the recommendations studies recommend that we can have a gold standards of these indicators like the wasting, stunting, underweight, BMI, and those type of things. And because these effectively gives a proxy for how well the food is being absorbed, how well the nutrients are being exploited out of this, abstracted out of this food absorbed within the body. So those are the different indicators. And lastly, if we need to, some studies actually take consider the stability. Some studies skip those sort of stability dimensions or take these stability dimensions in some of the other dimensions. But these stability related indicators are those, it may be related to any one of the three indicators, which leads to the reduction in the risk of above three dimensions like availability, access, and utilization. For example, if we have the better irrigation coverage, it may give a proxy for more stability in the production and those aspects. Then the variability in the market or accessibility related factors, maybe we need to see that whether the domestic food prices are more volatile, it is not a desirable situation as far as access to food is concerned. So these are not the exhaustive list. These are some of the indicators which came to my mind in the different dimensions related to food and nutritional security. We can always append these indicators, and it's not that we should take all the indicators together. We should see that whether if we are going to assess the food and nutritional security at the district, at the meso level, or at the state level. So probably we may skip the indicator related to household level. Or if you want to go use the household level data, we probably may not have the data related to percent of villages having ODF status or the monthly status and both that of things. So the nature of the measurement for those indicators will change depending upon whether we are going to estimate the status at macro level or at the household level. One challenge actually arises once we use this index approach, because out of different indicators we need to develop a sort of composite index, and for making this composite index, weighting is very, very important. The weight assignment is very important, and that becomes very challenging because we do not have a thumb rule for the weights. We have the several approach available with us. We can either go for the theory-based subjective approaches, like we can go for the expert opinion, then take the expert opinion on which dimension should be given more priority, which dimension should be given less priority, and then accordingly we can assign weights to different indicators. And then, or if we don't have the expert opinion, we can simply assume the equal weightage method. We assign the equal weights to each indicator by assuming that each indicator is equally contributing to the different dimensions. We can also use some of the mathematical and statistical tools like principal component analysis, entropy weight assignment methods, and many other methods are available. Sometimes what happens that we use more than one methods, take an average of different methods, and then use that weight in the final composite index. So it is all subjective, it is all conceptual, it all depends upon the purpose of our evaluation, it all depends upon the availability of data, and the level of aggregation, whether it's a household level or it is at a meso or the macro level. So this is the broader approach for measuring the food and nutritional security. Uh, as I said, this index approach is an indirect approach. We can, why not to go for directly asking the person or the beneficiary and ask what is his or her perception, whether he or she is nutritionally feeling secure or insecure. So the FAO and United Nations bodies have uh, uh, developed several such scaling techniques where we can have direct perception based this recordings by the this beneficiaries and ask their experience. We develop a sort of questions, and based on their perceptions, they respond to different questions. Like a well-known food insecurity experience scale developed by the FAO has developed the 8 questions in which the respondents or the beneficiaries are asked to scale that where do you rate between 1 to 10 on each of these 8 questions, and then finally, based on their perceptions, then scales and scores are developed, and we can categorize that household in the scale of most food secure to most food insecure on the continuum of that, and this becomes a, a handy tool actually. Generating data for the indicators or the index is very challenging. It's resource intensive, but such type of indicators such as the food insecurity experience scale or any other direct observation based techniques are less resource intensive. They are directly measured. So we have many positive points or the pros for these type of experience based measures. At the same time, we can also suffer from the challenge of biasness from the respondents. Sometimes what may happen is that the respondents may be biased. He may get fear that if I truly tell that now I'm not the food insecure, so probably my previous entitlement may be reduced or the removed. So in that anticipation or the fearness, he may not respond properly. But there are different ways that we can reduce those biasness. We may not we can clearly tell those respondents that we are not going to reveal your identity. No one is going to tell. And there are many such techniques in sampling designing level that we can do that. These two techniques, whether index technique or this food insecurity experience scale technique, we can customize it according to our need. Suppose if our purpose is to evaluate the food safety nets program, then we can formulate and frame our own objectives, our own indicators, collect the data, and sometimes what happens, we use a hybrid way. We use both the techniques because maybe at the pilot stage we can also collect the food intake level data from the each household and estimate the incidence of undernourishment, for example, and then we can ask the same household members that what do you feel that whether your food secure or insecure, and then we can integrate and corroborate these two sets of data and see whether both corresponds to each other. So that way we can establish that whether both the methods give the same robust results or not. If they give the robust results, we can use either one of that depending upon the resource availability and our objectives in there. So that approach is also very well. In the developed country, what happens that the food insecurity experience scale has been widely tested, and they say these both the approach, like indirect approach, index based, and they give almost the similar results. So it all depends that what is the how we have formulated the things, and these 8 questions have been widely. I think more than 150 countries have have tested this type of scaling techniques in this particular FIES technique. Thirdly, is that on the statistical econometric modeling, I think the use of this type of technique is very, very pertinent if our purpose is to develop and establish an association or linkages between the indicators. So that we may not be very successful in terms of this index approach or something. We can use some of the econometric modeling to develop some extent of linkages among the pathways or the strength of the pathways between the food intake and the nutrition outcomes. I would like to just uh, give you a glimpse about this such usefulness of such tool by drawing linkages between agricultural productivity, farmers' income, rural poverty, and undernourishment using some simple correlation coefficient. So we know that this we can see based on the extent of this degree of correlation between the agriculture productivity is positively associated with the farmer's income. It means that if agriculture productivity is improved, so farmer's income may increase positively. At the same time, agriculture productivity is negatively associated with the rural poverty and undernourishment. So this way we can see this how the agriculture nutrition connect can be measured by using these type of things. Similarly, the farmer's income and rural poverty are negatively associated. If we improve the farmer's income, so rural poverty can be also be reduced to some extent, and the undernourishment can be reduced. Then the rural poverty and undernourishment is positively associated. So rural poverty is more than undernourishment is more. At the same time, what agriculture productivity is influenced by its own determinants. For example, if agriculture productivity is depending on the rainfall deviation, if the rainfall deviation is higher, then the productivity is less. Irrigation coverage, groundwater development, fertilizer use, its own factors or the inputs. Similarly, the farmer's income is affected by not only the productivity but also by the land size, share of agriculture in workforce, land man ratio, or the marketed surplus. If the marketed surplus is there, more, so farmer's income is more because farmers will be selling that produce to the market and deriving the income. Similarly, we can have the associates or the correlates with the rural poverty, like population density, family size, and all other demographic indicators. Then the undernourishment, which I took as an indicator for the nutrition, in addition to the farmers' income, productivity, rural poverty, it may also be affected by the access to anti-Narega, BPL, and the MPC or the income. So all those things provides a glimpse that we can discover the nature of association between the different indicators so that we can develop a linkages between these things. Then we can develop a econometric models, a tentative theoretical model. We can write something like this: agriculture productivity is a function of irrigation coverage, fertilizer use, and all the inputs. And then we can estimate the productivity and put the productivity in the second stage and see that how it influences the farmer's income. And by estimating these two equations, we can develop a linkages between the two equations, along with some other factors which we should consider for the farmer's income, as we found this correlation coefficient matrix. Then farmers' income can again be taken as an explanatory variable for the poverty rates, and then poverty rates can be taken as an explanatory variable for undernourishment. And here we can have some other variables like access to PDFs. So here, if our purpose is to supposed to evaluate the program for the food safety or access to PDFs, if we want to know whether access to PDF is positively affecting the undernourishment or not, so we can have a marginal effects by controlling the effects of all other factors. And this marginal effects provides a impact actually of that particular indicator which we are going to consider in that. So these econometric tools are the I think only tool available with us through which we can develop a linkages, through which we can develop a marginal effect and quantitatively estimate the impact of different rates. My last part will be a sort of suppose if our purpose as is in this workshop is to see that at the household level whether the PDS is really contributing to the household nutritional security or not. before I go to these evidences from NSS consumption expenditure surveys, I would like to share that successive NSS survey in India says that over a period of time, the calorie intake, average calorie intake in the country is declining, and there are several factors on that.
Yeah.
But
Dr. Shivendra, can we conclude now? So in the interest of time, we actually.
sure. I may
Yeah.
take 4 minutes if you permit.
Yeah, yeah.
Yeah, okay, thank you. So,
Okay.
so at one place we say this calorie intake is declining, but another place we say this access to PDS is improving because the share of PDS supply in total rice and wheat is increasing. It has increased from 9 to 27%. So does it mean that when it is not contributing, does it mean it is not contributing to the calorie intake or the nourishment or not? So for this purpose, we need to control all other factors and see that what is the marginal contribution of TDS in the total dietary intake, and that for that we can take the help of these econometric things. Simply by estimating and controlling all other factors, we can see the marginal effect of the PDS on the calorie intake is positive, and that we can use to draw some of the policy these matrices also, that out of total change in calorie, for example, between 93 and 2004, official report of NSS says that calorie intake declined, and but marginal effect of PDS was positive. And between 4 to 5, the marginal effect of PDS actually accelerated, and that contributed to the increase in the calorie, which happened between 4 and 5. So that way we can develop or establish the fact that these programs are working well, and or whether it's working well or not, but to what extent it is having a positive impact or a negative impact on a particular outcome, which is nutrition impact. Finally, I would like to just maybe I can stop it here because time is less. But actually, it throws that there are some limitations in the data because nutrient intake picture is not being integrated with the outcome based pictures, and both are given a contradictory results. And it is mainly because of lack of integrated database. Simply, we say this in the theory, this income is improving, but we are seeing the improvement in income, but the undernourishment is also increasing. Does it mean that we are seeing a disconnect between income and nutrition? But it does not mean that income does not have a positive or marginal effect. It do has, but the net impact is something else, and that can be seen once we follow the food system approach in that. Similarly, like the income, we do see the increase in the food availability, but it is not getting 100% translated to the intake. That shows there are many other factors which we need to consider while evaluating the impact of a particular program. Thank you very much. And sorry for taking me.
No, no, thank you, Dr. Shivendra. So, thank you very much for actually you have covered some of the parts which I was also trying to cover in terms of the modeling part and design part of So thank you very much for the detailed econometric statistical methods and the perception-based index FICE and about the index approach to capture the various food and nutritional indicators. And you have given in very detailed manner which are the indicators that we can actually look into for each of the availability, accessibility, absorption, utilization, and stability. So, to carry forward the discussion, I would be so is my screen visible? Yeah. So thank you. So basically, I will quickly go through the in the interest of time, we'll be discussing the basic ingredients that actually determine the evaluation design. So, as Dr. Shivendra also told that it is the research question or the objective which we are trying to assess that determines what kind of design we will be actually taking up for the evaluation study. So evaluation of any program or scheme is important because the government has limited resources which has alternative uses. So therefore, evaluation is of prime importance, and therefore, so that we know that national resources are going into proper, are channelized properly to have good outcomes attained. And it also, in terms of food, in a subject which is of immense importance in a developing country like India, where, as Abhayji has already pointed out, that we are one among food insecure country with 30% of food starvation and are from India only. So, so basically, now I will limit myself to the only the design part of it, so that because it's a very broad issue that will take a lot of time if we go into that. So, basically, we will any evaluation design firstly is directed by the primary objective or the question, the research question which we want to answer. So, secondly, it will be the data. What is the data which is available to us? Are we collecting the data on our own? That will be a primary survey based data collection. And based on that, we will try to evaluate the program. Or is it we are relying on some already national level representative survey like NSS or NFHS? From there, we are trying to use the data to evaluate our research question. And the data availability, how is the data available? Or is it available at a particular point of time? That we means is, say, the cross-section availability of data, or the data is available over a period of time. That is what we say as the time series data availability. Or do we have the data across time over various regions? So that will be a panel data. Or we also can have pooled cross-section data that does not have to have the same regions over a period of time. So it is a panel data will be highest and most the best data which we can get. Second will be a pooled cross-section data. Then we can have cross-section or time series data. So these are all type of data which is available. And based on the data availability and your research question, you will design your evaluation design. And as Shivendra ji also pointed out, that the unit of analysis, so at what level we want to do the analysis, is it at state level, is it at macro level, or is it as household level, or do we want to analyze it at individual level? So what level? So that also determines the indicator which we are trying to assess. So in case of nutritional indicators, we go at individual and household level. If we have a want to assess a macro picture, then we will look at a broader region. As Abhayji was pointing out, the region wise, we can see that there is hunger. It is not related to any kind of district or state. So that kind of the unit of analysis will also determine what kind of design we will use. Then the timeline of availability of data, is the data frequently available, or is it available over a gap of very long period of time? Like you see the NFHS data, which was available earlier, like the 3, 4th, and 5th round. The now we are reducing the gap of NFHS data availability to less than to like around 3 years. So earlier the third round was 5, 6, then the fourth round was 15, 16, and now we have 19, 20. So if we have frequent availability of data, that actually enables us to do better analysis of any intervention. So any scheme, any intervention, how do we analyze that? How do we analyze their impact? And there are various things which we can analyze. Impact is one of them. So, and like the and there are other various things like process evaluation, or we want to do other forms of evaluation that most the highest form being we try to link the causal linkage from the independent variable to the dependent variable. That is, we do through the impact analysis. Then, as Dr. Sivendra was showing us the in his slides of regression analysis, we have to take into account a number of control variables. So without that actually takes care of the omitted variable bias. So whenever we are trying to assess the impact or relationship between not correlation, going beyond that, we will have to actually control for other variables. So in economics, as we always say, like keeping other thing constant, this leads to this. So does our independent variable explain a certain percentage of variation in the dependent variable, keeping other thing constant? So that is how we will try to establish a relationship, an association, or causality between the independent variable and the dependent variable. So one of the important things that we need to always take care when we design such evaluation design is to factor in and the concept of endogeneity, and make our main explanatory variable which we want to look into. And we will come to specific case studies which has been already done and published in refereed journals. So how your main explanatory variable is independent of any other influences and explains changes in the dependent variable. So keeping everything constant, if you give this food security or food safety measures or the food subsidy, what is actually led to the benefit in terms of independent variable, whichever you are trying to capture, in terms of nutrition, in terms of availability, in terms of absorption. So whatever be your dependent variable, how has it been explained by any particular intervention? That intervention could be in the form of NFSA Act, and which has led to increased reduced prices of the wheat, rice, and or the coarse cereals, and how has that actually led to improvement in the nutritional indicators, if that is what we want to see. So basically, the identification strategy is actually, if we can say, the basic methods are of three types: experimental, quasi-experimental, and non-experimental. And there are other methods which also available, which is to evaluate any schemes or program is or any intervention is mixed methods, which actually takes into account not only the quantitative part also, but also the qualitative aspects of any particular scheme or intervention, that through focus group discussion and in-depth interviews, key informant interviews. Apart from this, we can also have a case study approach based scenario, where we take one particular intervention in a very limited region and try to understand based on the socioeconomic background, the geography, and other things, taking into what has led to a success or failure in that, which the case study approach is not perfect, and no method is perfect for that matter, is that we will not be able to generalize it further. So mostly in any design, you also want to have this feature of generalizability. That means your whatever results you have found, that you can say will also hold in other similar situation. So apart from that, there is OECD's RACI approach, which is relevance, effectiveness, sustainability, and impact approach. This is also commonly used in evaluation of schemes and programs and interventions. So broadly under experimental, as you all know, it is the randomized control trial, which is used quite often to actually see the impact of any program. However, it is not always possible to do an RCT because it is expensive, and it requires a lot of time also to conduct. But that way we actually try to establish a direct cause and effect relationship, and this is one of the best instrument available to do that. Apart from that, there are various quasi-experimental methods which we can use, and we will see also later in my presentation, which has been used in the context of food and nutritional security aspect in India. So there are difference approach, instrumental variable approach, regression discontinuity design, multivariate regression models. Taking it is nothing but a multivariate is taking into account more independent variable and having like control, as Dr. Shivendra showed. And regression discontinuity, I'm just giving a brief overview because these are in itself a huge area of study. So given the time, I will limit myself to the basics. So regression discontinuity design is having a particular cutoff above which and below which we try to measure the change. If we somebody gets into the program just because there is a BPL cutoff line you have fixed, what is the impact on that individual who is just above the line and who is just below the poverty line? And we then say that because of this program, what has been or the scheme or the intervention, what has been the impact of such a program. The difference is actually comparing the treatment and control group over a period of time. So a treatment is those people who get into a program or scheme, so who are beneficiary, and those uh, control is those who are eligible but they did not get the benefit of the program. So and we see the outcomes of these particular groups over a period of time. Generally, we say it pre and post. So prior to the implementation of the program and post the implementation of the program. And then we see the average difference between these two groups and attribute that to the impact of the program. Instrumental variable, as I said in earlier my discussion, that the problem of endogeneity, to break that problem of endogeneity and make your independent variable exogenous to other factors, we use this instrumental variable. So your instrumental variable, as we will see in one of the example later on in my slide, is that helps you to establish a relationship from the independent variable to the dependent variable via the instrumental variable. So that is in brief the quasi experimental methods which is available for us. And non-experimental, this is, as I said, the case study approach, and they and other methods also, but they basically do not focus more on the attribution, that is not on causality or impact. They actually focus more on what we have learned from a particular case study or event. So this we have already covered, so maybe I can skip and come to the most one interesting studies. I have picked up these three studies, though there are numerous studies in terms of food and security safety net analysis in India and abroad. But I picked these because they have used different types of data, different design of evaluation, and they have done it for different time periods and coverage in terms of sectoral coverage and time period also they differ. So they provide a kind of diversity, and this will give you a more or less idea about the universe of evaluation design we are talking about. One study is by Srinivas and Prabhu Pingali et al. In 2018. They actually see the first, let me tell you the findings. So they find that the in kind, so in kind what we are providing the subsidy has actually led to improvement in nutritional outcomes. Mostly in India, we and in theoretically we have found lesser evidence of such positive impact. But this is one of the study which has found. Now my job is to focus on design. So how they did it? They exploited the state level changes in the generosity of the PDS. What does that mean? That means that whether the PDS is available at a very subsidized price. So earlier it was maybe available at 5 rupees. Now they have reduced it to 1 rupee. So the generosity meaning at a reduced price or more quantity. So that is what generosity means. So they have taken these states where the generosity have increased, whatever may be the reason, and they see the effect of such generosity in PDS through PDS subsidies and its impact on the nutritional outcomes. So how do they do it? They use both the cross sectional and temporal variation over a period of time. They have, because they are using a panel data, and panel data of 5 years of 1,300 households. So that gives them over time that is time series and cross sectional. So they have this panel for 5 years, and therefore they can actually see the impact of this generosity of PDS subsidies by comparing the beneficiaries who are the treatment and the control group who did not benefit, and taking the difference. So taking the difference twice, and then basically this is a fixed effect approach, but it is mostly akin to what different says does. So that is what they did, is that they took the difference between the BPL household who were exposed to a more generous program as compared to those who were not. And then the second difference was between the BPL household before and after the PDS expansion. So one is having a difference between the groups, and then the difference during the before and after periods. So that is taking the two difference out actually captures the time and so basically which we say fixed effect, time fixed effect, and the sector fixed effect or region fixed effect, whatever you want to control. So that is the region fixed effect, and one is time fixed effect. When you take control for this, you get a clear kind of impact assessment. And since they had a panel data, they were in a position to do so. However, the one caveat is the number of households they did it is for 1,300 households. So again, the generalizability of any particular study design is based on how big is your data set, that is the n, the sample, and what you want to generalize it to the capital N, that is the population. So in that, it has to be representative to make it more it's believable in terms of generalizability of your findings. Second interesting paper is by Jha et al, Raghvendra Jha, from Australian National University. So he also in his paper found that his finding was that the protein and micronutrient intake has increased with the PDS participation. So this is what his finding was, he and co-author. So the coming to the design part is basically they use the instrumental variable. And why do they use the instrumental variable? Because the independent variable here is the PDS participation, and the dependent variable is protein and micronutrient intakes. So PDS participation influencing protein and micro nutrient intakes. That is our hypothesis. That is what they wanted to test. So, but there can be reverse causality, that the protein and micronutrient intakes are less because they are from poor people. Therefore, they are participating. To check for this reverse causality, and to get rid of the endogeneity problem, they use this instrumental variable. And what does the instrumental variable does? That breaks the endogeneity problem and provides you a clean impact of your independent variable, that is the PDS participation on the dependent variable. And how did they do it? By using an instrument for the independent variable PDS participation instrumented by land ownership or distance of PDS shops or waiting time in the PDS shops. So an instrumental has to be relevant and exogenous also. So relevant in the sense it should be uh, highly correlated with the independent variable which it is instrumenting. So your PDS participation is definitely determined by the distance from the PDS shops. If it is very far off, you can't go that long. If the waiting time is also larger, then your participation comes down, but it in no way actually has a direct impact on protein and micronutrient intake. So how far is your house from the PDS shop actually does not directly influence your protein and micronutrient intake. It can through the PDS participation, and that is what instrumental variable is all about. So this is also a very good article that shows us how actually an evaluation design can be used, and this is what they have done through primary data, and they have used it for a from a cross section, that is a particular point of time they have collected this data. They did not have data for earlier time period, but in a cross section data point they use this IV variable and try to form a relationship one-on-one between the independent variable and the dependent variable. So apart from that, there are other methods, as I have just specified the mixed method approach, which actually says that both quantitative and qualitative. One of the good example is John Dress, and others who have actually into 2018, they did a analysis of 6 states, and they found that in four, the PDS system is doing well, as Bihar and Jharkhand being the outlier where it is not doing well. And they actually, what they did is that they did the primary survey in these 6 states, and mostly their selection of the states were purposive sampling because they didn't have resources to cover many others. But apart from that, when they come down to blocks and villages, they actually deploy the random selection of blocks and random selection of villages, and they canvass from door to door, and they collected data for 3,800 households, and based on that some quantitative assessment and qualitative assessment they did, and come out with their findings that four states are performing better in terms of lower targeting errors or increasing the coverage. So that is their findings, and they use this both the qualitative and quantitative method. So I think I have overshoot my time, so I will just stop here, and maybe we can go to the next part of the of today's session. Basically, I would we have actually kind of covered the ground of basically Dr. Abhay, starting with uh, the timelines of how the food and nutritional security aspect uh, emerged in the context of India and globally also. And if I may start the moderated discussion part. So I would like to ask both the panelists that whenever we talk about food and nutritional security aspect, we there is always a question of leakages. So the pitfalls which we see in terms of food and nutritional security, there is the amount of leakages. Some reports say that it is almost about 40%, and this has been a real challenge actually to stop that, and so it is kind of availability also addresses goes to the question of availability. So the government has made the effort to actually supply the ration at reduced prices, but is that actually reaching the poor? And that will actually also go to the Dr. Shivendra. I would like your opinion also regarding where do we have to like look into the process part to kind of stop these leakages. I will first invite Dr. Abhay and then Dr. Shivendra.
Thank you, Avinash. Yeah, you raised a very important aspects of the entire TPDS, because one of the biggest challenge that the TPDS has experienced so far is the leakages issue. In fact, this leakages issue are so enormous, so overwhelming, that when the National Food Security Act was formulated, the discussion around the National Food Security Act was going on in 2019 to 2013. There was also a discussion to abolish the entire TPDS system, just because of these leakages and all. Because there were, as you rightly said, that there were estimates from 35 to 42% of the leakages by different studies. So from that perspective, yes, it has been a major challenge. But the good part of the leakages issue is what the 2013 National Food Security Act has brought out a very comprehensive reform idea into the TPDS itself. If we refer to chapter number 4, there is a complete chapter which is suggesting on the number of reforms to augment the TPDS system. Some of those includes, automation of the entire TPDS supply chain, the use of the information education communication technologies, information communication technologies, treating the beneficiaries with Aadhaar card, so on and so forth. So there has been number of suggestions been incorporated, and the good part of it that many of the states have come forward and they have implemented many of these reforms ideas. So as a result, now we hope that the leakages must have gone down. Now the leakages which appears to be there is largely because of the inclusion and exclusion error, which is still there. So now the major challenge before the government is to strengthen the criteria of inclusion and exclusion, so that those who are excluded and beneficiaries needs to be included into the system, and those who are not in those who are already included into the system, they, if they are not eligible, they need to be weeded out. So those challenges are still persisting, but there are serious efforts to measure the leakages at these times. I think there is a high time that we study that and we try to measure that, because in the recent past, after the NFSA, I am not particularly aware of any study which has tried to measure the leakages of the TPDS. So I'll stop here and I'll give the floor to the Shivendaji to take the conversation forward.
Thank you, Dr. Abhay. I think my response is also on the same line as you said. There are several studies which shows that leakages are to the extent of even 50%. My own calculation based on NSS shows that it's 47%, but it was for the year 2011. And truly speaking, that we do not have any household level data to re-estimate after in the recent years. So most of the time it is based on the out of the supply chain, whether what is the extent of leakages because of spoilage, wastage, washer, and all those type of things. And then second part of the leakages is also of course that exclusion and inclusion errors. So we do have some of the options at the program level, like the government is focusing on the decentralized procurement and other things. So we are thought of also in addition to the technological reforms, ICT reforms, as you said, is tracking system. That institutional reforms are also underway. Decentralized procurement and other such systems are having lots of scope to reduce the leakages, and there are still specific studies by using this survey-based things have clearly mentioned that over a period of time in the recent years, the leakages have reduced to a great extent. And even the Ministry of Consumer itself says that it's less than 1% of the total that in the recent years. Uh, so that way, we are saying that intervention level, we do require intervention technology and institutional reforms. That's the only way to reduce the leakages because the system is too vast. It's a too big system. We cannot stop leakages, particularly by the wastage and all those type of things. Yeah, over to you.
Yeah, thank you. Yeah, so basically, institutional reforms and some of them, yeah, as Dr. Abhay rightly pointed out, NFSA has in its act itself reforms, and basically there are uh, uh, there are a number of provisions that can, if implemented, and some of them are being implemented like EPOS and others, electronic and using of Aadhaar seeding and all those things. So yes, I think that broadly covers what are the ways we can actually fill the leakages and actually see the benefit which reaches the beneficiary, intended beneficiary. The second, actually, one aspect that came up in the discussion, in the presentations, is it's kind of paradox that our economic the affordability part or the income part. So Dr. Shivendra said that there is like a positive relationship between your income and the nutrition, because it makes your food basket more affordable because you have higher income. But at the same time, you have, as Dr. Abhay pointed out, that it is not specifically related to the BPL or this thing. So there is other food insecurity or nutritional insecurity in the higher income bracket also. So how do we see this as a does this is it a very huge paradox, or is it livable with? So I will reverse the order now. I will ask Dr. Sivendra first, then Dr. Abhay.
Yeah, thank you, Dr. Das, for asking this question. I think this is important because we do see a paradox when we see that it is a double burden actually on nutrition. That obviously the poor people who cannot afford to purchase the food from the market at the prevailing rates are suffered, and data clearly shows that about 70 to 80% of the poorest of the people are suffering from incidents of undernourishment. But it is not true particular to only to the that poor people, but even the rich class of people, about 20 to 25% are undernourished. So here I think that emphasis should be given that identification of factors which are responsible for such type of paradox, because those factors are very essential. The factors which are working for the poor people or the middle class people are not the same factors which are working for the rich people. For the poor people, it is indeed the income options or the less income which is responsible for that. But for the poor people, rich people, it is more of the awareness which is very, very important. For the poor people, the poverty reducing impacts are most important aspect for improving food and nutrition security. But for the rich people, we need to provide the awareness about the nutrition. They need to know that they require that, and they need to diversify their food baskets. To take home food should be more in growth type of thing. So that paradox is very well there. We have the lots of undernourished people. At the same time, we have the 5 to 6% of the population as obese. So both the double burden of nutrition has to be taken by properly diagnosing the factors responsible for that, and then proper interventions in that aspect.
Thank you, Dr. Sivendra. Over to you, Dr. Abhay. Dr. Abhay, I think you are on mute.
Sorry. So yeah, very quick response to this. In fact, a wonderful question to discuss. In 2019, World Food Program, in partnership with Ministry of Statistics and Program Implementation, has brought out a National Food Security and Food and Nutrition Security report, in which we have highlighted this challenge very prominently. We have shown, with the help of the 68th round data, that how the under nutrition and overnutrition, both of them are playing its role and contributing to the malnutrition of the country. So that paradox still persists. I would also like to what Shivendra ji has just mentioned, that there is a change in the food intake or food consumption pattern, and this change is also being induced by number of marketing and branding. And as a result now, it's of course there is a challenge of undernutrition among the poor people, but to some extent even this the consumption of the junk food, in terms of not safe food, I can say, among the poor people are also increased. So from that perspective, and also we have also seen the data around the non-communicable diseases, which are also increasing a lot in the poor population, because of the the what you call, not a good pattern of consumption, the food consumption. So from that perspective, yes, it's a challenge. And as and when we work around the undernutrition, India is of course placed very badly, because right now at one hand we have to deal with these undernutrition challenges, but at the same time now the overnutrition challenges, is obesity and all, they are also posing a very big challenge. And already we have estimated that around 20 to 25% of the population of India is now obese. So from that perspective, it's going to be a huge health burden for the nation that needs to be taken care of as soon as possible. I'll stop here.
Uh, Yeah, thank you, both of you. So I will take a question from audience. There is in the chat box. So maybe this is about five. So it may be addressed to Dr. Sivendra if you would like to take. So I will just read out. This is from Samudha Goswami. The question is, since FICE is a perception-based scale, does it increase the risk of over or underestimating food insecurity? And is it tested to provide consistent result over time?
Thank you. I think this is a very pertinent question on that we really do require a cautious approach for such type of things, because the chances of biasness is of course there, because we are asking a person whether your food is secure or insecure, and he will respond as per his background about his education, his background about his culture, society, and those type of things. And this approach do suffer from such type of biasness. And these are the well known that such type of perceptions of behavioristic response will be biased if it is not properly collected. And so for that sort of reduction in the biasness, we do can reduce to a large extent such type of biasness by the effectively designing the sampling plans, by effectively engaging the respondents, and by training the respondents that what should be the perfect way to ask these questions. Because those questions which have been made in this FIs, that 8 questions are made along with all different sorts of the professionals like nutritionists, health workers, and psychologists, and those are bound to be biased because of the respondents from these things, but we need to reduce those respondent response biasness by properly designing the sampling plan. At the same time, that cons is always there, but at the same time, it is the resource less resource intensive and easily doable exercise. So, and most of the studies at the international level says that this gives So robust actually results at the population level. So those are the biasnesses are there, but we have options to tackle with those type of things. As far as whether it provides a consistent result, I think this particular tool is tested across more than 100 countries. So it is a well tested tool available with us. Do have some statistical methods also to convert sports into statistical measures also out of these process available. Thank you.
Yeah, thank you very much, Dr. Sivendra. One last question from audience. This is from Mr. Gordon. His question is, if I got you right, out of population of 1.4 billion, 1 billion, that is 75%, are reached with food support monthly through the food safety net program. What then is the core problem with the food and nutritional security in India that is making 71% of population to be under food nutrition safety net program? How is the evaluation focusing on this core problem or objective to inform decision making on a long-term solution? So, Dr. Abhay, would you like to take this? Or anyone, Dr. Sivendra or Dr. Abhay, anyone.
I think Abhay is responding.
I was on mute and speaking.
Okay, okay.
So yeah, thank you, Abhinash, and thank you for
Mr. Gordon. Yeah.
Mr. Gordon for posing this question. In fact, you raised a very important point because this is a big dilemma or big paradox which the country is right now facing and is still trying to unearth the reasons behind that. But you know, some of the regions that has come up from the programmatic data, programmatic knowledge, programmatic evidences is basically now we have to beef up the social and behavior, change communication. So from that perspective, we need to work around that a lot because the, the government is trying to provide its best to cater to all the vulnerable groups with so much of investment and so much of intent as well. It's not that the government is just spending money; it's spending money to tackle the challenges. But despite that, the successes are not there. So from that perspective, I think the evaluation is one of the purpose of this, and this evaluation was to unearth some of the factors that is leading to this paradox. So hopefully this evaluation will try to unearth some of these factors contributing to this paradox. Over.
I may also supplement Dr. Abhay that these food and nutritional security programs are being operational since many years in India or the decades in India, and this paradox is indeed present. And one of the reasons which comes to my mind is that earlier the programs were being operationalized in an isolated mode. That one program does not use to interact with other programs and something like that. Like ICDS and PDS were different, totally different, run by the different ministries. But here I would like to highlight that after this National Nutritional Mission and by particular efforts by the Ministry of Health and NITI Aayog, that lots of convergence is taking place between these programs under the umbrella mode. And that convergence is leading to some good fruits that overlapping of activities and other things are being realized. So those are I think that the positive steps which are being there, and evaluation may also that explore such type of positive things in addressing these type of things. Thank you.
Yeah, so thank you very much. So that actually provides what our intentions are and how far we have reached over a period of time. We have made certain improvements, certain we have gone into feed more people and stop the leakages and also make India more food and nutritional secure. But there is still miles to go before we sleep. So, with those words, I will close this session, but there is in the chat box we have a link for those who want to join the next group work session. So you can kindly join with the help of this particular link. It's up for the panelist. It is also optional. So for everybody, it's optional. If you want to stay back or if you want to go, so that is up to you. So we will be here to assist you. So thank you very much once again for being a part of this rich discussion. And we have tried to get a encapsulated uh, uh, understanding of the theoretical underpinnings, the indicators, and some designs of evaluating food and nutritional safety nets over the world and in India. So thank you very much once again.
Thank you very much, Dr. Das, for the opportunity. I have one meeting, so if I may be excused.
Yes, please. Yes, yes, please.
Thank you so much. Thank you so much, Dr. Abhay, and all the organizers. Thank you so much.
Thank you, Avinash. Thank you, Shivendra ji. Thank you, participants.
Thank you, Dr. Abhay.
Bye bye.
So Vijay, uh, how are we planning? So like we will go from here to this from the link right away.
Yes, Avinash and all participants, we are shifting to the other link. Please click on that and we will see you on the other link where we'll have our breakout sessions.
Okay, great. Thank you. Thank you. See you on the other side.
Yes. I join as a guest. आ गया हूँ.
Hi, Yashashwini, Vijay, Shruti, and Deepak.